My name is Matthias Löhr. I'm the professor of gastroenterology and hepatology at Karolinska Institutet and the University Hospital here in Stockholm, Sweden. I work mainly with pancreatic diseases, and as part of it, I was drawn into the world of IgG4-related diseases. We did the European guidelines for GI, that is gastrointestinal manifestations of IgG4-related diseases. We are overseeing some 400 patients with IgG4-related diseases, and I was part of the steering group developing and executing the MITIGATE study. IgG4 is a systemic disease which can virtually affect all organs in the body. That is comparable, say, with other quote-unquote rheumatological diseases. The difference here is that the major manifestation of IgG4-related diseases is in the GI tract, and they're mostly in the pancreas and the bile ducts. However, other glands, such as the lacrimal glands, the salivary glands, can be affected. The brain, the so-called retroperitoneal space, can be affected. The eyes, the testes, many organs can be affected. It is a little bit dependent where they enter, quote unquote, the healthcare system. Due to the manifestation, as said before, many will enter the system, so to say, through the hands of a gastroenterologist, taking care of, say, the pancreatic and or biliary duct manifestation. Others come typically from the ENT physicians because they have, say, swollen lacrimary or salivary glands, or lymph nodes in the cervical area. So these are the two typical entries for these patients. These are results from the MITIGATE study, which in total was published earlier this year in the New England Journal of Medicine. And we now looked specifically in different groups of patients, demographic, age, sex, and then the result from treating those patients with a new drug, which is Inebilizumab, short INEB, versus a placebo. So that was a double-blind, controlled, randomized study, which was conducted globally, one can say, with some 135 patients. Overall, the drug was able to decrease the flares, that is the reoccurrence of the disease, when treated the first time with steroids, under then a steroid-free period. That is to say, the patients received initially a small dose of steroids, were then tapered down, and received either the verum, INEB, or placebo. And then during a one-year period, the number of flares was counted in these patients. And here there was a drastic result, one can say, in that almost no flares occurred in the verum group with INEB versus many flares in the group which did receive placebo. The take-home message number one is that this new inhibitor, which is depleting B cells, is very effective in preventing the reoccurrence of the disease. And it only be given 3 times to result in this dramatic effect. This is very good news for the patients. Then when we looked into different subgroups, which is important because the ethnicity is different, obviously the age and sex of the patients, there was virtually no difference in the overall group. Now, particularly in those patients, and that was presented earlier this year, not during the EULAR in Barcelona, but during the DDW, that is the Digestive Disease Week in San Diego, and then later on during the liver meeting, EASL in Amsterdam. The patients who have a manifestation in the pancreas, in the bile ducts, they even profit more than the entire group, and certainly much more than the placebo group from this new drug. We have already B-cell depleting therapies used in other autoimmune diseases, and they have been used off-label also in IgG4-related disease. With new drug, Ineb, which is a CD19 antibody. For the first time, we have an approved drug, which is very effective in treating the flare, that is the reoccurrence of IgG4-related diseases in general, but particular in these patients who have a manifestation in the pancreas and the bile ducts.